We are live. Thank you all for joining. Dana, Dr. Chrysopoulo, I'm Christine, Brave founder. I'm going to kick it off to you, Dana, our executive director.
Thank you so much, Christine. We are super excited to have you back on, Dr. Chrysopoulo. We've had such good traction with these talks. Patients and our community are just so interested in what everyone has to say right now. So definitely adding value to our community. Something, we were kind of talking back and forth via email, and something that you had mentioned was, really planning ahead for elective surgeries as ORs are starting to open up now that, states are starting to come back around. What is the process of that, and what can patients, do to plan ahead?
Yeah, great question. Thanks for having me back. It's always fun to chat. You've had some great surgeons on your show, so great stuff. So for sure, different parts of the country opening up more and more with every passing day. States opening up before elective cases can resume. And first of all, what does elective mean? People think that elective means cosmetic surgery, or many people think that. Cosmetic surgery is one example of elective surgery, but the word elective just means non-life-saving. So you don't need to have the surgery to save your life there and then. It's elective. So, a hernia of your belly button after a pregnancy. How many women have that, right? So repairing that is an elective surgery, because you don't need it to save your life, right? So that's off the bat. So by definition, elective surgery can wait. So, and that's why elective surgeries were canceled and postponed during this whole crisis. Now we're seeing in most states the number of infections per day coming down. So that's the first thing, is no one should be talking about resuming elective surgeries unless the new infections have been declining on a day-by-day basis for the last 2 weeks. So that's number one. Secondly, hospital systems need to work with their local governance. So state laws, city laws, all those prerequisites have to be met, and everything has to be kosher. So those two off the bat. If you're looking at having surgery in a ambulatory surgery center or a plastic surgeon's office, they have to follow the same rules. So bear that in mind. Have a very honest, upfront discussion with your surgeon. Talk about what their process is in their office or in their ambulatory surgical center, and just have a very frank conversation. What happens after that point really is going to vary a lot, and that comes down to testing. So in our facility, you can't get your surgery without a PCR test. So that's been billed as a gold standard. It picks up whether you're infected.
What does PCR stand for, Dr. Chrysopoulo, for the layperson? Sorry.
Polymerase chain reaction. It's a type of study that looks at particles of the virus. So, and there are pros and cons to that approach, but that's the best we have. Now, so you don't want to, as a surgeon, you don't want to operate on someone who's COVID positive, because that significantly increases the risk of complications. So there was a study out of China that looked at patients having elective surgery, not breast reconstruction specifically, and not just plastic surgery specifically, but all types of elective procedures. So all these patients had no symptoms and they weren't tested, so no one knew that they had COVID. And of the patients that went through, it was 34 patients, and having surgery and getting a general anesthetic led to all of them developing pneumonia, and 20% of patients died. Now, that's one study. Far from perfect in terms of the study. It's just data that I don't think people should ignore. So you can shoot the study down, but basically the bottom line is this. If you're COVID positive and you don't need surgery, don't have surgery, because it significantly increases your risk of complications and possibly death. So that's why we don't want to operate on someone who's COVID positive. Now, back to the pre-op testing. Here in San Antonio, where we are, you can't get a procedure at PRMA without getting a pre-op COVID test. Mm-hmm. If you refuse your test, you can't have your surgery. If you test positive, you can't have your surgery. However, patients really need to know that the testing isn't the be-all and end-all, because it's not 100%. Far from it, in fact. Why are we doing testing? We're doing testing primarily to pick up people that don't appear to be infected. So it's the asymptomatic person who's positive that we're looking to pick up on. Here's the problem with testing. You can have a false negative. So what does that mean? That means you get the test, it comes back negative, but in reality, you actually still have COVID. Now you don't know, and you're under the false security of having a negative test. A lot depends on the timing of the test and the timing of the infection. So if you get COVID, if you are going to develop symptoms, and not everyone does, but if you're going to develop symptoms, then on average, it will take you 5 days to develop symptoms. Okay. So in those 5 days, you're just walking around potentially exposing folks and passing on the virus. And the average person, from the data we have right now, the average COVID positive person passes the virus on to 2.3 other people. That's the average. Okay. At least 2 people. Now, here's the thing about the test. If you're tested, let's say you happen to get the virus in the morning, and then you're tested that day, chances are you'll be negative on the test. You'll test negative because you haven't had the virus long enough for it to be picked up.
Right.
With each passing day, the chances of you testing negative when actually you're positive, the chances come down. So by day 4, you've had the virus for 4 days, so you're positive. The test, though, still won't pick it up in everyone. And there was a recent study that said that there's a 67% chance you'll test negative, even though you're positive, if you've had the virus for 4 days and you don't have symptoms.
Wow.
So we think there's a connection between symptoms, showing symptoms, and you testing positive. So now you look beyond those 4 or 5 days and you look at day 8, 9, 10, you're far more likely to have a positive test, a positive result, the longer you've had the virus, whether you're showing symptoms or not. But so take-home message, number 1, testing helps, but it's not the be-all and end-all. Number 2, your facility may not even be doing testing on everyone, and they may only be offering it to high-risk people. And when you see how many tests lead to false negatives, you can understand why not everyone is hanging their hat on testing. And the next point is this. Other types of screening are really important because if you've been isolating, social isolating, distancing, you've quarantined yourself, you've been following the rules, and you've been laying low and not coming into contact with folks, wearing a mask, where, when you go out to the store, when you can't social distance in particular. In some states, they're requesting you wear a mask all the time when you're outdoors, whether you can social distance or not. That kind of varies depending on the state. If you've been following all the rules, the chances of you having it are very low. And now you've got the negative test in conjunction with that. The people we worry about are the ones who haven't been following the rules, haven't been distancing, haven't been isolating, and then they're not truthful on the verbal screening. They fall through the cracks, or they pass the verbal screening, and now they have a negative test, so everyone thinks it's great, when in reality they could still be positive. So people, I implore people listening to this, you have to take responsibility for yourselves and your actions and be truthful, because the biggest, the person who has most to lose here is you, by having surgery and being positive. Don't take it lightly. And of course, you're also exposing others, which is irresponsible.
Hey, Dr. Chrysopoulo and Dana, there was a couple questions coming in from the audience. Dana, can you see those on our feed?
Yes, I can. I didn't want to interrupt him. I was like so infatuated.
Sorry, I was on a roll.
It's amazing. We could go, always these go long with Dr. Chrysopoulo because he has so much great information.
No, but I do think that that's important, because like you said, you're not only putting yourself at risk, but you're putting the surgeon, you're putting the OR team, you're putting everyone else that's in that situation at risk too. So being really honest and open is like super important. Yeah. So go ahead.
You follow the rules and you're honest and you test negative. That's the most anyone can do.
Yeah. Okay. So here are two questions. They kind of coincide. How does all this testing compare to tests for other diseases? Like, for example, the typical flu. And wouldn't you just delay surgery if someone has a typical flu as well?
Yes. So I don't know how good testing is, because, we're day by day, we're getting more results that's showing it's not as good as we thought to begin with. So I don't know what the final verdict is going to be on the testing. I've got to tell you, I mean, I was thrilled that we were going to be able to offer testing to everyone before surgery. But I didn't know that the false negative rates could be so high if you test someone really early on, when they've just gotten it and they don't know it yet. So for me, it's just really, we've always been very OCD about the verbal screening, but we've got to really make it very clear to people how important that is, and for them to follow their local guidance, in terms of distancing and masks and hand washing. It's really, really crucial. And you can, and then the second part was, you said, can we just delay? You meant if someone tests positive?
So the question was specific to like the flu. So wouldn't you normally just delay a surgery if someone has a flu? Yeah.
And for elective surgery, in the big scheme of things, in the scheme of that patient's life, it's no big deal. Sorry, my phone's ringing. In the big scheme of things, it's not a big deal to delay elective surgery if you test positive. The fact that you're testing positive is a much bigger deal. We want you to be okay. We completely obviously understand that a lot of people who are coming been asked to wait. They already had all these arrangements that were put off and had to be rearranged.
Right.
Financially right now, it's a disaster for so many people.
What about the antibody testing? I know my mom had it done for, I think, like $75 or something. What do you think, like, the effectiveness of the antibody testing?
I think it's very, very low effective.
Okay.
I don't think it's anything that we can hold our hat, hang our hat on. There's so many tests now. It's really unregulated. You don't know what you're getting.
Yeah.
You don't know really which, you don't know for each test exactly what antibody is being tested for. It's all over the place.
Right.
We actually, Dr. Chrysopoulo, we should invite a friend of ours of Braves on to talk with you. He invented the first at-home AIDS test, and he's been in the news a lot because he works, in the space, and he said exactly what you said. There's so much non-regulation going on. These shops. There's no regulation.
It's a false sense of security.
Mm.
My wife was really sick in December. We were in Florida and we traveled through Miami, and she had a very weird, primarily respiratory illness. She had, whatever she had knocked the wind out of her sails completely. She was out. My wife's hardcore. Nothing gets her down, typical mom, right? So for my wife to be out and to just, I've never seen her that fatigued.
Did you test her for anything?
We haven't yet, but so we would love to know if she was one of the very early folks, just because of our travel through Miami. Who knows? But even so, would I get her tested? I'd love to get an antibody test, but even then, it doesn't prove that she had COVID back then.
Right.
So
I had pneumonia in November, Dr. Chrysopoulo, and I was traveling a lot, and the same. I've never been sick, and I had a fever, pneumonia, and was in bed for a week. So I was kind of thinking the same as your wife.
Yeah, you could, right? Who knows? It's impossible to tell, but yeah. So listen, no one's going to put off your surgery lightly, but if there's a question, you don't push to have it done, because it's really in your best interest just to delay. The other problem with testing and the PCR test is that it picks up bits of the virus, right? So there are many people that test positive for a long time after they've gotten better. So clinically, they're great. Their oxygen blood levels are great. They're not hypoxic. There are no symptoms, nothing. Everything's perfect, but they're still testing positive.
Right.
So we think that's because of viral fragments that are still hanging around, and the test is picking up. So in terms of rescheduling, again, your elective surgery after a positive test, the follow-up question is, what do you do with that? When is it safe? And so speaking to our infectious disease experts locally here who are very involved also on a national level, the recommendation is that you should postpone your elective surgery for at least 28 days after the first positive COVID test.
Okay.
So there's something else for people to know. It particularly impacts us because people travel from all over, and people are starting to travel again to come back to PRMA from all over the country.
Mm-hmm.
So there are very, very strict guidelines that we have to follow. Patients, whether they test before they come or not, really the only reason for them to get a test before traveling is for them to cancel the trip if they test positive. Beyond that, even if you have a negative test before you get on the plane and travel, you're still going to need another negative test to have your surgery here. And we're asking people to self-isolate when they get to San Antonio until they have their test. Then they have their test the day before the surgery, and then they have their surgery. Unfortunately, people who test positive, obviously it will be a surprise because they would have passed all the verbal screening and all the rest of it.
Yeah.
Then they have to quarantine in San Antonio for 2 weeks before traveling home, because you can't travel when you're knowingly positive.
Right.
So, the issues are going to continue for a while. There are going to be ups and downs. There are going to be tweaks to protocols. There's going to be new data on the testing. Hopefully we'll have a vaccine soon. And I know there are lots of opinions about that too out there. So let's not get into that.
Okay.
Because then we'll really go over time. Yeah, I mean, everything as it's been for many, many weeks, it's a very fluid situation. So lots of.
Well, I just want to thank you so much. We are so proud to have you as a brave surgeon and one of our partners walking alongside of us, coming on here and just sharing your wisdom with everybody. So I jumped the gun earlier, so I'm gonna I'm going to extraduce you. I'm going to do an introduction at the end. So Dr. Chrysopoulo is the president of PRMA, and he's also the creator of the Breast Advocate app. So if you want to hear more from him, we did drop the name of the app into the chat, and we will pop it up on all of our social media feeds. And we appreciate you. Stay safe, stay healthy, and we'll talk to you soon.
Sounds great. Take care.
Thank you.
Bye.